Okay, then we will continue with the regional plan for implementation of program budget 2018-2019 in the WHO European region. And I would like Susan Basiri to introduce this topic.
Madam Chair, Regional Director, distinguished delegates, ladies and gentlemen. It gives me a great pleasure to provide you with a presentation on the regional plan for implementation of Program Budget 2018-19 in the WHO European region. Just an overview on the situation from the current biennium walking towards 2018-19. The program budget 2018-19 is the final program budget in the 12th general program of work. It builds on continues on the building on priorities that are identified in the general program of work and focuses on unfinished agenda. It is built based on bottom-up priority setting and the matrix environment of management that we have followed in the European region. And it incorporates based on lessons learned during the last two biennia. There is a particular focus on countries. And definitely the program budget 18-19 regional implementation plan has more explicit linkage to Sustainable Development Goals, and further strengthening interdivisional work and for delivery of results. Now, if I can quickly draw your attention to what we have been doing for implementation of regional plan for program budget 2016-17, in the current biennium status as of date shows good progress towards achievement of the set targets. We have certainly have greater focus on country-specific programs. There is a significant emphasis and work on outbreak and crisis response component. In the current program budget, about 22% of the financing that we have for the European region is allocated for outbreak crisis response work. And there is an expecting significant surge in this area. We are in realistic budget level, and 80% of the allocated program or approved program budget is financed. And we are expecting additional funds in the pipeline. Financial implementation is in line. We are slightly behind, but implementation of available funds are totally on track. And delays are, of course, always explained to you in previous occasions as well. That is due to certain uncertainties or processes that we have in place in terms of receiving those sometimes highly specified financing. When it comes to situation in terms of the type of financing we are receiving, there is, as Regional Director alluded at on day one, was that we are seeing, while income is comparable to previous biennium, but there is much more specificity of financing and decrease in flexible funding. Misalignment of funding and priorities continues. And there is a change in priorities by contributors or donors. And there is a reliance on a small number of contributors. But a very quick point on progress made or a status as of date in terms of accountability and compliance that we have is that we have completed 2016 internal control self-assessment, and accordingly, annual declaration of interest and letters of representation for 2017 are being published for regional director in WHO website. We have conducted managerial and administrative reviews in several countries, and based on those, we have taken certain actions. We have an updated risk register for 2016-17 based on information from all budget centers. And we have integrated the risk management information and the risk register results in our planning for 2018-19. Ongoing work continues for closing remaining internal audit recommendations and follow up on areas that requires further work. Now, if we go and take a look at the regional plan for implementation of 2018-19, as you have noted in the documentation, the regional program budget 18-19 implementation plan outlines our contribution to the global outputs and outcomes, and it forms our principal means for programmatic and budgetary accountability for the coming biennium, same as the current biennium. For 2018-19, we have a share of budget approved at the level of 261.9 million, which is about 6% of the total budget of the organization, second smallest across different regions and headquarters. But compared to current biennium, we have 2% increase. This 2% increase is due to the new program in health emergencies, the implementation of the strategic budget space allocation model, which increases the share of budget space allocation for European region, and prioritization of member states in terms of what you have already discussed in terms of environmental health, and the Secretariat for monitoring sustainable development goals implementation, which has a small increase in category 6. If we take a quick look at the highest rated based on bottom-up planning priorities for European region, this is based on consultations and country consultations, the highest demand in terms of the count of the countries that are choosing these priorities, and continuity of priorities that are built on what we are implementing in the current biennium. And very similar to the current biennium, non-communicable diseases, health services, tuberculosis, mental health, health information system, mother and child health, just to name the few, are the top priorities. Program budget 2018-19 for European region is in full alignment with priorities that was identified in General Program of Work 12. However, it is also a bridge to new opportunities for partnership and joint work based on the foundation for achievement of targets in European region Health 2020. We have established a mapping of the targets of Health 2020 and Sustainable Development Goals target, which is aiming for 2018-19 to properly monitor and report these targets. And we have a better alignment of this monitoring and reporting framework in the biennial collaborative agreements for the country level. If we look at just the budget envelopes by category, in category 1, there is a very slight increase. The blue column is the current biennium and the green is the 2018-19. So category 1 shows a slight increase, and that is due to the unfinished agenda in communicable diseases in the areas of HIV, TB, and vaccine-preventable diseases. In category 2, prioritization by member states in European region brings a very slight increase. Unlike the global perspective, which is rather similar to the current biennium, but there is a slight increase in European region. For category 3, there is a prioritization of environment and health due although the challenges of financing remains. In category 4, overarching mandate under umbrella of health systems, universal health coverage, and public health is identified. And for category E, or the category that the area of WHO health emergencies, contains the WHO health emergencies, incorporates the priorities identified for the European region. There are slight decreases in several or few areas, and those is due to realistic budgeting, but then those areas are very slightly adjusted, including violence and injury prevention, health system information and evidence, transition in polio, endgame strategic plan, and overall reduced corporate funding in category 6. When we look at financing for 2018-19 perspective, we see that it is realistic in line with previous biennia. There is a masking of the serious in terms of financing unbalance. That was mentioned several times in previous discussions as well, that the better financed areas, programmatic areas with highly specified funding sometimes mask the areas that are underfinanced, but shift of resources cannot happen, and flexibility of resources are reducing. And of course, this is a projection that we need to look into. And then also we have a very good model or good practice and in the European region that are the geographically dispersed offices that are specifically supported by member states, respective member states. We will continue with our due diligence for strategic use of flexible resources, which is, as was mentioned early on core staff salaries for particularly to underfunded program areas, investing further and further on priority activities at country level, and of course, financing leadership and enabling functions. When we are addressing the gaps, we need to further look into financing contributions, our contributions to achievement of the outcomes, and the issue of value for money, or looking into where we are best allocating our technical collaboration or capacity and priority comes into our mind, and we will continue working further on that. And further alignment of resource mobilization with priorities, with focus on country level, and more work at the networks level, and with 3 level of conversations we have at the 3 level for better distribution of globally mobilized resources. Finally, the last slide, in terms of benchmarking, implementation, and indicators, we continue improving and working and refining on our work in terms of monitoring and assessing our achievements based on program budget performance indicators, which are our main means for programmatic accountability and contribution to outcomes at the regional level. And we need to show them and demonstrate specific key advances over the biennia, and with our focus particularly on value for money. We have baselines and targets. The documentation that you have is for your consideration, published in the regional committee website, shows our baselines and targets. At some of them are currently under construction and will be reviewed and will be finalized. And confirm the monitoring framework will be presented to regional committee next year. Thank you very much, Madam Chair.
Thank you very much, Dr. Susan Basiri. And I now open the floor for discussion. Member states wishing to speak, please raise your nameplate. Norway, the floor is yours.
Thank you, Chair. Norway would like to commend the regional office for this document. It presents member states with a very good overview of the funds and prioritizations of the region in due time. This allows for constructive debate on the budget priorities in the Regional Committee. This is an area where practice has improved greatly over the last years, and it is good governance. We agree with the prioritizations proposed in this budget. In particular, we appreciate the scale-up of the Health Emergencies Programme and agree that the main share of resources should go to capacity building at country level. Additional resources for this programme are required in order to follow up on the decision by the Health Assembly. We must all do our part, and we urge Member States to contribute to this programme in order to secure a sustainable build-up of capacities. Director General Tedros said at the G20 summit this year, universal health coverage and health security are two sides of the same coin. Norway fully agrees that universal access to basic health care is an integral part of avoiding future pandemics, as well as an important step in realizing the right to health. We are therefore pleased to see that Category 4 remains the largest category overall, despite a challenging financing situation globally. We are also pleased to see that the work on NCDs in our region will not be scaled down, but rather kept as a priority by the regional office. Thank you.
Thank you very much, Norway, and I give the floor to the Russian Federation.
Thank you very much, President. Regional Director, the Russian Federation supports the draft PB for the forthcoming period 2018-2019 for the European region of the WHO. There's been a 2% increase. We note with satisfaction also the increase of resources in all technical categories, including in the fight against NCDs. Now, despite the global cuts for this programme area, the European member states, take into account the burden of these diseases in the countries of the region and take into account regional commitments, reaffirm this area as one of the most important areas. Guidance for cooperation between the categories and also, this is something that can help us have a more effective management of resources, including when it comes to their allocation in order to prevent the freezing of certain programme areas. Now, among the priorities of the organisation, focus has been placed on creating strong healthcare systems to guarantee UHC. They will also help increase the preparedness for emergency situations, including the fight with outbreaks of diseases and various humanitarian issues. To achieve these goals, there's also strategic shifts. This will allow us to increase and accelerate the updating of normative recommendations and standards, and it can also give us alternative options when it comes to achieving the results within the member countries. The process of the implementation of the PB will help us implement monitoring activities. This will help us assess the attainment of the SDGs. Thank you very much.
Thank you very much, Russian Federation, and I now give the floor to Germany.
Herzlichen Dank.
Thank you very much. At the outset, I would like to endorse the statement of Norway. It is an excellent document, and we think that our region and our regional office can really be an example in terms of the PB. And I'd like to thank you very much for the oral presentation as well that we've just heard. Yes, it's probably a bit late in the day now that I'm taking the floor, but on the whole, apart from the way in which the PB is presented, there are a number of challenges for us which are very interesting. In this regard, we are a bit concerned about the issue of financing of the forthcoming PB. It's a challenge in our view, particularly with regard to flexible resources. If you look at the different donors for our region, then they don't actually come from our region when you think about it, when you look at things. So we are dependent on a small number of donors, and this seems to be a main challenge for the European region. Therefore, we hope that the donor landscape will increase in our region and change. The report says that focus in the future should be placed on resource mobilization at the country level, and in this regard, we would like to have more information from the Secretariat. Ultimately, this is an issue that the Director General spoke about at the GPW concept. Thank you very much.
Thank you very much, and I see no other delegates wishing to speak, and then I invite Dr. Susan Basiri to respond.
Thank you very much for distinguished delegates, Norway, Russia, and Germany, for very good points and your comments, which are all going to be taken into account in also improving further and further the work that is ongoing. And it's very encouraging notes that we appreciate with the team who is working on this. With regards to concerns raised in terms of financing, we share all the comments that already made in terms of situation and uncertainties, and we will have more information about the subject further perhaps by the time that we will report back to you in the time of standing committee of the regional committee, or closer to that at the time of executive board. But in terms of resource mobilization, new efforts, I would ask perhaps the regional director kindly to, if there is anything further than what we have so far, no, because there is a level of uncertainty that we need to have further information that we will make it more available for the next time or next round of reporting that we will have for you at the time of the standing committee or later. Thank you very much, Madam Chair.
Thank you very much, Dr. Basiri. This brings us to the end of our discussions for today.